active cases, and 29,418 tests were done in the last 24 hours. We now have 90.78% of Queenslanders have had at least one dose, and 86.85% are now fully vaccinated. And in good news, we've done 500,000 booster doses have been administered as of yesterday as well. So timely reminder that if you do need your booster, make sure you go and get your booster when you are due. It is absolutely vital. So we also have, I'll get the Health Minister to update everybody, but in terms of testing, can I say I thank everyone for their patience and persistence. The Chief Health Officer will give you very clear guidelines about who should go and get tested. We also have more rapid antigen tests coming into our centres, especially to go to those close contacts. And the Health Minister will update everybody in good news. The Health Department has been able to have a meeting with some of our private providers, and they will open 6 more private pathology sites this week from Wednesday to Friday in Ashgrove, Boondall, Edens Landing, Cleveland, Indooroopilly, Wilston and Bundall. Most of them, though, will be only open until lunchtime. We do need to see more testing sites, but I think, as everyone can appreciate, this is an issue that is not just happening in Queensland, it's happening in New South Wales, and it's also happening in Victoria. And finally, can I just say, in relation to proposals that I'm hearing today in relation to pensioners and low-income workers, in terms of having to be given a payment to go and get your rapid antigen test, can I just say this? This needs to be as simple as possible. It is very clear that the pharmacist can actually keep a record as to who has been given a rapid antigen test, but I genuinely believe that for our pensioners, our healthcare card holders, these should be made available to them for free. The 18 million that we are getting into Queensland, we will be putting them out through our testing clinics as they arrive. The Health Minister will update as to how many have gone out to date. But, you know, this is a pandemic. We need to make it as easy and simple for everybody out there. So that's the position I'll be taking into National Cabinet. I haven't seen a paper from the Prime Minister. I'm only speaking from what I've read in the papers today. But we just need to make it very, very simple and easy, especially to our most vulnerable people at this particular point in time. So I'll hand over to the Chief Health Officer.
So today we have 6,781 confirmed cases to report in Queensland. Of course, we know the real number is significantly higher than that because many people have mild symptoms that have not sought to be tested. Some people are having RAT tests that they're doing at their own home, and some people have had difficulty getting tests. So we are very well aware of that. So Queensland now has at least 32,312 active cases. That now includes the local government areas of Blackall, Tambo and Lockhart River, in addition to those which we've listed previously. But importantly, despite this significant number of new cases, there are still just 10 patients in intensive care, of whom the same two we mentioned yesterday, are on ventilators, receiving life support. So that is significant. There are more patients in hospital, though, with COVID, receiving care for COVID. 265 cases currently in hospital. So we are seeing an increase in the number of people with sort of intermediate level illness, not the critically ill, as we've seen perhaps previously in that first wave, but we do have a significant number of patients in hospital now with COVID-19, 265, and we know that number is going to increase in the coming weeks. But our aim is to treat as many patients as possible as home, which will be the vast majority, and there are 17,031 patients receiving COVID care at home. As of the 3rd of January, vaccination coverage is 90.78% for the 16+ population with one dose and 86.85% of the 16 plus population with 2 doses. And yesterday we gave our 500,000th third dose to a Queenslander. So we're very excited about that because, as we know, the third dose is particularly critical for those who are vulnerable and as well as healthcare workers as well. Now, we are well aware that getting PCR testing at present is difficult. So just to remind people of the nationally agreed position on who should aim to get a PCR test. So you should aim to get a PCR test if you have symptoms, the symptoms being fever, headache, runny nose, cough, maybe loss of smell, if possible. If you can't, get a RAT test, and we'll come back to what if you can't get either of those in a second. Get a PCR if you have a positive rapid antigen test. And thirdly, if you're in close contact, if you're a close contact in quarantine, then you need to get a COVID test on day 6, either a PCR or a rapid antigen test, to allow yourself to be released from quarantine. And can I remind you also of those individuals of what the definition of close contact is under the revised national guidelines. Close contact is effectively those people who are in the same household as you. We're no longer looking at work colleagues, etc. A close contact is regarded as someone who has spent at least 4 hours in the same household or same household-like environment, like a university college, for example. That's the definition, the current nationally agreed definition of a household contact. And as I've said before, I know it is difficult for some people to access PCRs and to access RAT tests for many people at the moment. So the vast majority of us, particularly if we are young and healthy and we don't have underlying immune disorders or underlying major medical conditions, will have a mild illness when we acquire COVID-19. And so what I'm suggesting to you is if you are sick with those symptoms suggestive of COVID-19, just assume it's COVID-19 and stay at home. If you stay at home, just look after yourself at home, and only consider requesting medical advice or going to an emergency department or dialing 000 if you have major symptoms such as breathlessness, significant chest pain, or fainting or significant dizziness. Those are the symptoms under which you should consider seeking medical advice or going to an emergency department or dialing 000. We've had a lot of reports of people dialing 000 the moment they get a diagnosis of COVID-19, even with very mild symptoms. And that really is causing a problem in many of our emergency departments, and it's not necessary. Also, if you are not improving within, say, 48 to 72 hours, because the vast majority of people start to improve within 48 to 72 hours, then also consider seeking medical advice. Okay, thank you very much. I'll now hand over to the Minister.
Thank you, Chief Health Officer. So the department had a phone hookup with the private providers yesterday to just assess the circumstances that are leading to private providers not being able to open at the moment, particularly across southeast Queensland. There's a number of factors which include the health workforce, and we know this is a challenge across the country. I've spoken to health ministers across the states and territories in the Commonwealth, and we know that healthcare workers is a real problem right now, both for our testing but our hospitals as well, particularly because of the number of positive staff and also those who are needing to quarantine as close contacts. We've also got issues that the private pathologists have shifted away from the way they have been testing in Queensland, which has been that they've tested in blocks. So they've been able to take whole batches and they test the whole batch to see if anything tests positive in that batch. And if there is a positive, then they individually test. Now, that works very well when you know the majority of the people coming forward getting tested are negative, because the majority of your batches will show up negative. So very few have to be individually tested. But now that we have such a large number of positive cases coming forward, the private pathologists are having to shift to doing individual tests, which has meant that it's reduced their capacity by around 50%. So it's slowing down their testing capacity and also to get those results. And that's why we're seeing some of the changes in our private pathologists. But I do want to thank our pathologists for working with us. QML have stood up today a number of sites that are drive-throughs, and they've been open since 7 and 8 o'clock this morning, and they'll stay open to about 11 or midday today. I know that people have already been lining up and getting tested at these centres today, so thank you for coming forward and doing that, and to all the QML staff and the Medilab staff. QML have advised that they will be open at Ashgrove from 7 to midday through to Friday of this week. QML Boondall will be open from 8 till midday, again till Friday. All of these sites will be open today through to Friday at these times. Eden's Landing 8 to 11, Cleveland 7 till midday, Indooroopilly 7 to midday, and Medlab at Wilston will have their drive-through from 8 till 11 a.m. Today and tomorrow, and also their clinic at Bundall will be 8 to 11 for Wednesday and Thursday as well. We'll continue to work with the private pathologists and also the Commonwealth to try to get these open far quicker and for longer hours, but I do appreciate the pressures on the private pathologists, just as we do on the public health system, and thank them for their work. I ask the public to please be patient, and I thank them for their patience. I know there's very long waits out there, both sitting in your cars and also lines, and especially standing out in the sun. So we're grateful for people's patience. I do remind people what the Chief Health Officer has just said, who should be coming forward: people who have symptoms, people who already have a positive rapid antigen test, and those who are household close contacts for their day 6 to come forward. Otherwise, if you are aware of you've been in contact with a positive case and you're asymptomatic, you do not need to come forward for a PCR test, and those who have mild symptoms but are not a household close contact at this stage, just monitor your symptoms. There's information on the website about how to look after yourself if you believe you have COVID, and also how to prepare your household for when someone does get COVID. So go get yourself a thermometer, make sure you've got some Nurofen or Panadol, those sorts of things at home. Just make sure you've got sufficient food if you need to quarantine for 7 days. So there's things you can be doing to prepare in case you are getting symptoms. I do want to give a shout out to our health workers again, who are doing a tremendous job. It's good to see we haven't seen an increase in ICU, but we do know that a number of patients in our hospitals are increasing, and I just want to thank all of our health workers for the amazing work that they're doing.
Thanks, Premier. Good morning. I'll just focus on those things that we're doing at the moment in our compliance operations, which are really about trying to slow down the spread. As you've heard, there are significant outbreaks and pressures on our system, so our role is to try and slow that down as much as we can. And there are things that our community can do to assist us with that. Obviously, social distancing, hygiene, but in particularly masks. We really need, I'm going to keep having to say this, we're having to run operations in certain areas, and again, the Gold Coast has been problematic. So 503 masks handed out yesterday, 437 of those were on the Gold Coast. And that was in safe night precincts, on the light rail and in shopping centres. So to our people on the Gold Coast, and indeed right across Queensland, wear your mask and carry it. Because we're also seeing 51 of the persons, another 51 persons were carrying their masks but not wearing them when they were required to do that. That's a really simple thing that our community can do for us so that we get a better outcome. We did have one arrest, unfortunately. A gentleman in Mount Isa entered a retail premises, a supermarket, refused to wear a mask, refused to leave, and then when police arrived, refused to comply and had to be arrested. That kind of behaviour is just so irresponsible, and we do not need this at this time. We had 71 calls for service in relation to both businesses and individuals not abiding by the Chief Health Officer's directions. We are continuing to try and educate our community on this. You know what your obligations are. Please follow them. We'll continue to be out and about as much as we can, and as the Health Minister mentioned, we have got significant lines. So our police are also getting called for instances of poor behaviour in lineups and also traffic issues with that. If you're attending any of these centres and you're having to line up, please be patient. We have seen instances of very poor behaviour where we've had to take action. Now is the time for our community to come together and behave responsibly. Thank you.
Just while you're there, Deputy
Sure.
Commissioner, I know you touched on this yesterday, but what has been the impact of COVID on resourcing in the QPSA?
Yeah, so at present we have 116 positive members. That includes 88 police, that's across the state, and 272 persons in isolation, or members of our organisation in isolation. At the moment our business continuity plans are effective. We're already implementing things such as online training, moving away from face-to-face, and we'll continue to do that. So we're very comfortable where we're at the moment. We're a large organisation and we'll continue to move forward, but obviously we'll just watch very closely how this impacts on us. Thank you.
Premier, just to revert back to the Prime Minister's comments this morning, two things. One, moving forward, what would be your thoughts on the rapid antigen testing? Would you like to see it blanketed out for everybody at a cut price? And also, do you feel a little bit let down by the Prime Minister at the moment, considering that he's pushing everybody to go to these rapid antigen tests and it's gone missing? We haven't really heard from the Prime Minister. These tests aren't being made readily available to the states.
I think what we found is that it was very difficult to get rapid antigen tests. I think the whole public and the whole community knew about that. I think it's good that he called a National Cabinet meeting to discuss these issues, but now we are seeing an impost that is likely to go on our low-income earners, our pensioners, and we just can't do that. I think everybody would agree from a practical point of view that we need to allow our most vulnerable to get those RAT tests as soon as they become available, and I absolutely believe they should be free to this cohort.
And what about everybody though, Premier?
Yep.
Every day, myself, every
Yeah, well, we're getting 18 million. I mean, I have really put my foot down to the department and I said, source me as many tests as we possibly can. We've got 18 million coming. Now, they're all not going to come at once. So I'm asking people for their patience, but they will be supplied free through our testing clinics. Other states are procuring as much as they possibly can as well. But this is a global pandemic, and I think Queenslanders will, particularly over the next few days and a few weeks, will see this as a very challenging period. We've gone for 2 years now where I've stood here and the Health Minister's stood here, and we've told Queenslanders we've had zero or very few cases. But this variant, as the Chief Health Officer said, is at this stage showing not many people in ICU, and at this particular point in time, only 2 on ventilators. This is a completely different strain to what the Chief Health Officer has seen in the past with Delta. So can I say to Queenslanders, please, if you have any questions, have a look on the Queensland Health website, and as the Chief Health Officer said, if you are finding it very difficult to breathe, that is the time to ring 000. But in the majority of people, the majority of cases, and I think now everybody knows someone who's had it, I know at least half a dozen people who have had this strain of COVID, and the vast majority of them are recovering very, very quickly indeed. So I hope that is the case with most other people out there. Now, to our people out there, especially our seniors and our vulnerable cohorts who have not had their booster, as I said the other day, the time is to stay at home and to wear your mask. For families that are holidaying, spend as much time as you can outdoors. If you're going to the beach, make sure you're socially distanced. If you're going for walks, make sure that there are gaps between you and other walkers. We want to keep the public, the community and Queensland as safe as we possibly can, but we will see a very quick escalation in cases, and it will come down. This wave will be a lot shorter than other countries have seen with Delta.
Premier, what have you made of these scenes we've seen at testing clinics, like just astronomical queues, and has the government failed to properly prepare Queensland?
I don't think anyone knew the impact the Omicron was going to have on the Queensland population. We knew that it would go around Queensland. I campaigned for 6 weeks telling everyone to get vaccinated. I think everybody knows that. We were out there in every single community virtually telling people to get vaccinated, and thank you to the Queenslanders who did. We always knew there were going to be cases, but I don't think we expected them to be escalating as quickly as they did, especially over this holiday New Year period, where we have health staff that have been on leave and have come back from their leave to actually help Queensland out during this particular point in time. There's many people who are not having holidays at this particular point in time who are actually sacrificing their time with their loved ones to look after you and to do the testing and to do the pathology and to do those home contact calls to see how people are going.
Premier, there's dozens of Gold Coast businesses that had to close their doors because they have staff waiting on tests or have tested positive. What's your message to them, given they've been through so much uncertainty already and now they're facing the prospect of having to repeatedly close their doors when this happens?
Well, the definition has been narrowed substantially. So National Cabinet was very conscious. We wanted to keep the economy open and keep businesses operating as much as we possibly can. Now, the way that happens is if you test positive, you need to stay at home, as does your household, for 7 days. So the other people in that workplace, but unfortunately in some instances I've seen staff that haven't been wearing masks. It is really important on the Gold Coast for people to wear their masks just to slow the spread, to actually keep businesses operating. It's a tough time. It's a tough time for everybody.
Did you regret opening the border at the time that you did when Omicron had arrived, when health staff...
We had a national plan and people wanted to see loved ones over the Christmas, New Year period, Melinda. Like, honestly, I saw scenes at the airport. I dropped a friend off at the airport. I saw people there hugging and kissing, crying. They hadn't seen people in such a long time. The national plan was to reunite families for Christmas. And a lot of people have done that. But unfortunately, Omicron is a highly contagious variant, and it's something that Queenslanders are responding to in the best way possible.
Premier, Dr. John Gerrard made some very sensible comments yesterday, backed up by the Health Minister just previous, that if you're a healthy young adult, you've got symptoms, stay at home. As the Premier, would you be calling on people today to do exactly that? That could help alleviate a lot of that worry?
I'm absolutely supportive of what the Chief Health Officer is saying. If you are symptomatic and you think you may have COVID and you know you've been in very close proximity to someone who has, then it's highly probable that you do have it and you can stay at home. With the RAT tests are coming, the rapid antigen tests are coming, and they will be available for collection at our major public testing centres in the very near future. And I've also been advised that the pharmacists will be getting extra supplies as well. So people will be able to get that.
People to come forward again, though, to get tested if they just feel a little bit sort of...
I think you should follow the Chief Health Officer's advice.
What about people who get told you're sick, you can't come back to work, you can't send your kids back to daycare until you return a negative test? Does that advice need to change?
Well, I'll get the Chief Health Officer to discuss that.
Just
Yeah.
on the peak is expected around when school returns. Has the government considered homeschooling alternatives or any sort of alternatives for that period?
Not at this stage. We're doing some modelling at the moment, and it's good to see next week that our children will be able to get vaccinated. My sisters have booked their children in to get vaccinated, and I'm urging other parents across the state to do the same.
Premier, when we had the intravilli cluster, we were doing upwards of 50,000 tests a day. What's changed now? We've had the border reopening days.
Yeah, well, we're getting on average 30,000. I think the issue is it's the Christmas New Year period, and the private providers, unfortunately, have closed over that period of time.
Does that annoy you, Premier, that they're closed? I know that you can't control it, but does it annoy you?
I can't. Look, it's great to see they're coming back. Can I thank them for coming back, because Queenslanders they wanted the check that they can get tested, and it's great to see them coming back.
Premier, is this phone hookup happened yesterday? Was there one, say, last week when we were forecasting, tens of thousands of cases before we started talking about hundreds of thousands of cases?
The Health Department has always been looking at this, but as you can understand too, some staff are also testing positive, so it has just been circumstances beyond our control.
Premier, do you know if the capacity of Pathology Queensland in terms of analysing swabs has increased since the start of the pandemic?
I might get the Health Minister to address that, but they were looking at that.
So given what has unrolled, do you regret opening the border when you did?
We had a national plan, and the national plan was to reunite families. That was the national plan that every other state and territory, Western Australia is a bit different, followed.
But the consequences of
The consequences are that the variant would have got here regardless. So even before we opened the borders, we were starting to see some small numbers. It is eventually going to be throughout Australia. It is a highly contagious variant.
But we knew that, so wasn't this the worst time to do it when people are away?
People wanted to see their family and friends and loved ones. Grandparents had not seen their children or grandchildren for years, sometimes since they had been born. That was the national plan. And I think you talk to any family member who has seen a loved one over that Christmas, New Year period would say that having that family member sitting around that Christmas table was worth the pain of the last 2 years. And it was difficult for families over the last 2 years in terms of when we asked people not to see each other to protect one another. We said we wanted to get the vast majority of Queensland vaccinated before the borders open, and that's what Queensland did. We got vaccinated, and as the Chief Health Officer said, the vaccines are working. So if you are unvaccinated, now is the time to not delay and go and get vaccinated.
This is the Health Minister. Minister, there's a report in News Corp publications today about Ipswich Hospital where some whistleblowers have gone on the record to say that there's some serious issues with Ipswich Hospital at the moment. They've got COVID patients in hallways mingling with other people. Just moving forward, Dr. Gerrard just made some comments then about 265, correct me if I'm wrong, in hospital at the moment is an increase, and it's steady but a worrying number. Moving forward, we know that Omicron's not as serious, but are you a little bit worried about hospitals such as Ipswich, maybe Logan, that might not be able to handle it in flux?
So that's an issue. I ask a question every single day. I get a breakdown of how many of our hospitalised COVID patients are in each hospital and what their capacity is and how they're coping. That we have the ability to transfer. So, you know, one of the first things I asked yesterday is where we at with Thursday Island, Yarrabah, Cherbourg health facilities, because even if you have only 10 patients in those facilities, that will put pressure on those. Are we in a position to be able to transfer? So those measures are looked at every single day. We're constantly analysing the pressure on the hospitals to ensure that we can deal with those surges. And yes, you know, there's going to be times where some hospitals see bigger pressures than others, and we'll continue to work with those hospitals about those pressures. And on the question of best timing to let COVID in, what would have been worse if we had done this in the middle of winter when we have a flu surge at the same time and our schools are open. So if all the kids had been at school and we had the winter flu, we would have been in a worse position. So as sad as it is to do this over the Christmas holidays, we are in a better position to do this now than if we had waited, 2-3 months. So, but I was looking yesterday, almost a month to the day, on the 3rd of December, Australia only had 4 confirmed Omicron cases, and there were 432 confirmed globally. US are now recording 400,000 cases a day and just had 1 million deaths. So this has moved so quickly for everyone. I think we're all doing our absolute best to try to manage what we are seeing is unprecedented transmission due to Omicron in the community.
Where are a lot of these COVID patients? Are they spread across, the
Yeah, look, there's about 4 hospital and health services that are carrying the largest amount of positive cases at the moment, which you'd expect. Brisbane being, central, so Brisbane North, Brisbane South, of course the Gold Coast are seeing big numbers, Ipswich and Logan. So not surprisingly, heavily dense areas as far as population are seeing the largest number of positive cases. And I do want to reinforce, particularly people on the Gold Coast, continue to come out and get vaccinated, and that goes for everyone. Our vaccination clinics are open, and it was good to hear reports yesterday that good numbers of people are starting to come forward and getting vaccinated again. We need people who are due for their second dose to come out on time, people who are due for their booster, because we know the difference the booster will make with Omicron. And of course, if you haven't even had 1 dose yet, come out and get vaccinated, because sadly, I'm still hearing cases of people in COVID wards who are not feeling well, who are saying, I wish I'd got vaccinated. I don't want to hear these stories. It is never too late to come out and get vaccinated. Get vaccinated now.
Minister, just to recap Marlene's question from before about when we were doing that in the early cluster, it seemed to be working, the testing lines were perfect. Just in
Yeah.
your opinion, I would have thought, looking at it, we were probably more prepared than any.
So
Did you
two
feel
major things that have happened that wasn't happening during the Indooroopilly cluster. We have the capacity to do 60,000 a day comfortably if we have all of the staff on board and if we've got all the private pathologists operating at full capacity as well. Now, with staff pressures due to positive cases and close contacts that everyone is seeing across the country, probably Western Australia is the only exception there, that is putting pressure on our ability to operate the hours that we want, and the shifting of the private pathologists to doing individual testing as opposed to batching. We've been doing batch testing for months now, and it's worked well in the private pathology space, but it has led, I believe, to a 50% reduction in their turnaround times. So that's going to have an impact.
Moving forward with those rapid antigen tests, would there be a system that you can put in place to say I've got a test, I can then register it online with the government?
So we are looking at all of that, and it's a conversation I had with health ministers this morning, but we do want to still be able to track it. So as much as you could say, if you've got a positive RAT test, you don't need to get a positive PCR, you should assume that is your positive. We want to be able to make sure we're aware of who those people are and make sure we can support them in the community. So that conversation's happening across the country right now about what's the next stage. We're constantly re-evaluating, taking the advice of the Chief Health Officers and AHPPC, and I have no doubt, at a national level, there'll be continue to have conversations around all this.
Last couple of questions.
And just on the capacity of pathology Queensland, are they batch testing? Has that increased since the start of
I don't believe we're doing batch testing because there's just too many positive cases. In some cases, I heard yesterday, 23% of all the tests are coming back positive. A lot of the people who are coming in with positive RAT tests just for reaffirming, and they're all coming back positive. So,
Can I please ask the further comment on my earlier question about employers, daycare centres and the like saying you can't come back until you've had a negative result? Is that appropriate at this point?
Can I comment on two things first of all? First of all, one question you asked pertaining to the opening of the borders, and I want to back up what both the Premier and the Health Minister has said. This pertains to the opening of the borders. This virus is extremely contagious. It's an order of magnitude more contagious than the virus we had before. This virus would be here whether we open the borders or not. If there is a good time, there is never a good time for a pandemic, there is never a good time, but if you're going to have it, having it in summer when schools are on vacation, that's as good as it's going to get. So the decision to open the borders, I think, was the right one, and it was before my time. I fully support it, and to be honest, it would have made no difference. Those places that still don't have COVID, the Omicron variant, places like Western Australia and China, they still have to work out what they're going to do. They're still going to have to go through this somehow. We're all going to have to go through this somehow around the world. So that's just on that the first question you asked. On the other question with regard to those people who are they're quarantined because they're household contacts, yes, we do still want them to get a day 6 RAT test. RAT tests are being distributed to the high volume public hospital clinics now, and they'll be start to be available certainly from tomorrow. I can't tell you which ones and when exactly the numbers there will be, but they are being distributed now, and we still want people who are the household contacts of known COVID patients to have a day 6 test to clear them, either a RAT test or PCR test, to clear them to go to work.
But even if people are unwell and their workplace says you can't come back in the door until we've had a negative test, but they can't get one, then they're losing out on work.
Well, if they're unwell with symptoms, then they should be isolating for 7 days.
And the two lines with the rats that you'll have, will people be handed the testing kits and then do it themselves? And say with the drive-through clinics, we'd be handing that?
It'll be up to each individual health service to work out their own system of how to distribute the RAT tests.
If they're people assuming that they're got the virus, how do they deal with that moving forward? Like, how long do they isolate for? What should be the
Yeah, it's a good question. I think in the current context, they need to assume if they've got that they have COVID and isolate for 7 days if they can't get a RAT test or a PCR. So that's the 7 days.
Dr. Gerrard, we've heard that some COVID testing clinics have closed because they've run out of a liquid substance that's essential to the testing process. Are you aware of this?
I'm not aware of that specific issue.
Dr. Gerrard said that the pandemic will end this year. Do you agree with him? I mean, a lot of Queenslanders are probably struggling to understand that now, see that.
Well, what we know, what we strongly believe is this wave will last a period of weeks. The question is whether there will be another wave this winter, and that will be purely speculative to look at whether it will happen again this winter. But we know we have to have this wave, and we know it will generate immunity in the community. And the general pattern that happens with pandemics over history is that you get a big wave and it gets small. You may get smaller waves in the future, and as time goes by, the virus becomes endemic. Sorry, say again?
Thank you.